conversation. We've had these for years in somebody's home with cookies and tea and sociability, but it's a new world. And we are going to take this, a feature of Zoom, and we're very happy to have here Michael Fine, who had been in the belly of the beast as director of the Department of Health, and now is a physician who's working with Central Falls and who writes a regular column for Go Local. We also have Josh Fenton, who's the leader of Go Local, which has been our only rigorous source of news about the vaccination in Rhode Island. So please mute yourselves. If you have questions, and I hope you do, use the chat button, we'll ask. So we'll start with Michael Fine for about 10 minutes and then Josh for about 10 minutes, and then we'll open it up to questions. It is supposed to be a conversation where you ask them questions via chat and they can ask you questions or the audience questions. We are hoping for the kind of give and take that happens in a living room. And I guess I should knock on wood. So let's start with Michael Fine.
Thank you very much, Joan. It's very nice to be here. If for no other reason than because my mother was an enthusiastic member of the League of Women Voters all the time of my growing up in Glen Rock, New Jersey. And so I have these great fond memories of her organizing events like these, from when I was 6, 7, 8, 9, 10 years old.
You say Glen Rock?
Makes it a great bit more fun. In terms of our pandemic.
Oh, Tom Pablo said hi, Jack.
Yep. Please mute yourself, except the speakers.
In November or September or October, something like that.
You're back.
Of 2019, a virus likely crossed from a bat to a human being, we believe someplace in China near Wuhan. And that virus, which is named SARS-CoV-2, began to cause disease in human beings. The name of the disease is COVID-19. After it being a coronavirus discovered in 2019. Not a very sophisticated approach to naming, but that's the one that was used. This was a new virus to human beings, and it spread rapidly. Because it's a new virus to human beings, essentially none of the Earth's 7 billion people have substantial immunity to it. So it has and had and continues to have the opportunity to infect virtually all of us. Now, as a virus, it's, in a class of viruses called coronaviruses, which cause colds. And though it's certainly troublesome to us now, in the world of viruses, it's not by any means the most intense or the most severe. The case fatality rate, the percentage of people who get it who will die, is likely close to 0.4%, which is about 4 times the case fatality rate of influenza. But at 0.4%, it is a fraction of the danger that's caused by viruses like Ebola, which kill 50 to 75% who get them. The virus spread rapidly and for a number of reasons, much of which have to do with the failure of our systems. We were unable to prevent its spread. Similar viruses, SARS itself or MERS, were well contained with a few thousand infections, but not COVID-19. And so it has spread around the world. It has caused now very close to 2.5 million deaths around the world. And very soon, probably in the next 10 days, we will cross 500,000 deaths in the United States. Because it's a new virus, we, when it was first introduced, had no test for it. We had no vaccine and no treatment. And that caused a fair amount of our chaos because when it spread rapidly, we had no way to control or reduce the number of people who got it. And so hospitals filled up, and you saw the scenes of hospitals being overwhelmed and too many deaths in New
Depending
York
on what
and in
button I put
Italy
with different
and
people.
many
I
other
can't them
places.
all.
Um, and it has been a bit of a challenge, more than a bit of a challenge. And I think of COVID-19 as the great revealer, because I think what it's done is revealed things and shortcomings in our own organization, our own politics, our own culture, that some of us suspected but hadn't known for sure. And it certainly made them loud and clear. It seemed like we didn't have the internal resolve to be able to do what we needed to do to prevent its spread. We couldn't agree on masking. We couldn't agree on social distancing. We couldn't agree on locking down for periods of time in order to prevent spread. And certainly the United States and certainly Rhode Island have been about the hardest hit places in the world. And I think that reflects to some extent our disagreement. And it also reflects to some extent the actual inequality that had become more intense over the last 30 years, that exists often with people who live in poverty and people of color being on the downside of that inequality. And the example that I think of most is Central Falls, which was the hardest hit place in Rhode Island, and thus one of the hardest places in the world. And the reason people got sick was pretty straightforward. That people in Central Falls remember, Central Falls is 70% or more Latino. People in Central Falls living in poverty couldn't work from home. Only about 10% of people of color can work from home. So, people who live in Central Falls had to go out to work every day. During our lockdown, they were allowed to go out to work. The factories didn't shut down. The construction sites didn't shut down. And so they got infected often at work. And then they would come home, and people in Central Falls live in triple deckers in densely packed housing with 4, 6, 8, sometimes 12 people living in a 2-bedroom apartment with one kitchen and one bathroom. And that meant that people would bring home the virus and pass it quickly through whole families. So Central Falls became rapidly infected. The Department of Health estimated that by the end of December, 50% of the population had COVID-19 already. And then we also didn't have much discipline about how we did testing, about making sure that everybody had access to the kinds of testing and care. We didn't do a great job at doing that in a particularly organized way. And so the opportunity that I think we probably had over the summer to really push the disease down to a level that was controllable, we lost. And so the disease spread rapidly throughout the state, and we got badly hit over the course of the last couple of months, seeing 400 to 500 deaths a month for December and January, and probably close to that, probably 300, 350 deaths, 400 deaths we expect in February. Remembering that when we had 300 deaths from opiate overdose, that was a doubling of the previous rate for a few years before, and we all got very upset. That was 300 deaths in a year. We are having 300 deaths from COVID-19 in a month. And we learned, what was revealed was we don't do a great job with nursing homes. We don't do a good job protecting people in nursing homes as hard as we try. And we just have challenges all over the place that we seem to have kind of been in denial about. But the virus doesn't respect what our thoughts and beliefs are. The virus is a little bit like fire and a little bit like water. It's like water because it seeks its own level, and it's like fire because it will consume everything available in its path. Now, the good news is we devoted resources to developing a vaccine or vaccines. The bad news is that we have a marketplace and not really a healthcare system. And so that when the vaccines were developed, and they were developed rapidly, the two that have been released are very effective, among the most effective vaccines we know. That's the good news. But the bad news is it feels like we don't have a coherent system for distributing them. And we certainly haven't been able to produce enough volume of doses to get the spread of the virus arrested yet. We're hoping that those numbers will improve by summer, but our track record so far is far from good. The new challenge, of course, is that as viruses spread, they mutate and evolve, and so new variants have developed, variants that are more transmissible. And so the risk to us all is that those variants will spread quicker than we can get the population vaccinated. And that puts us at risk for another surge over the next few months. And some of the predictions suggest that that third surge may be larger than the first two we've had. With that, why don't I turn it over to Josh?
It's a little apocalyptic. Okay, Josh. With the shrinking of the journal, Go Local has been the only source that has dug deep into COVID beyond the numbers, the whys. And so please talk about the journalism behind the story, behind the crisis.
Sure. So, we're 10 years old now, and we've hit that level of being a top tier news organization in Rhode Island. 1,000,001 visit the site every month, which is in the top tier. When we started in 2010, the Journal had a newsroom of 120 people, just to give a little example. And now there's about 10 reporters. We were somewhat built for this. We'd had a long-standing partnership, a very unusual partnership. There aren't many news organizations that have a content partnership with an Ivy League medical school. And so we had, on a every other week basis, Dr. Salloway or Vin Moore coming on talking about critical issues of healthcare. And it was a very, very in-depth relationship on the science and the medicine. So that had been going on. So we felt very comfortable taking on, well, most news organizations in a local market don't have a tremendous amount of depth on healthcare. And especially something like this, which doesn't come along very often. So we started writing about this in January. I think our first story was January 16th or so. By February, we knew what was coming, and we felt a firm understanding. And I remember we had a woman on, Kate Mason, who's a professor at Brown University, who had written a big story written a book about the last big outbreak in China, and was now at Brown. And she was over one day, and this was probably around mid-February. And I said to her, we were not live on the air, this was sort of in the green room. And I said to her, why don't we just close the borders for a few weeks and see what happens? She said, oh, no, you can't close the borders. You can't impact, global trade and things like that. I said, it doesn't really make any sense. If you're closing down Wuhan, wouldn't you want to close down everywhere? And I think we just had an innate sense of how this was going to develop, which gave us an ability to delve into this quicker and faster than anyone else. By the first week, the first case in Rhode Island was March 1st. That was the first confirmed case. It was tied to a trip at St. Ray's to Italy. There's very good indications that there were cases earlier in Rhode Island, but that has yet to be proven. And by the second week in March, I had reached out to Dr. Fine to have him start appearing on our daily broadcast. By the second week in March, we had found a woman in Italy. Italy was about 3 to 4 weeks ahead. And they're still 3 to 4 weeks. I'm going to tell you some important information. They're about 3 to 4 weeks in every wave over there ahead of us. And she started to be a weekly resource for us, live on air and giving us, she's in a PhD program over there. She's lived there for 5 years in Bolzano in the northwest corner. And it was like having another reporter in Italy feeding us back information. I want to say by the 10th or 12th, we urged the state to close down in an editorial. I was back and forth with the governor's chief of staff, David Ortiz. He dismissed it repeatedly. By a week or 10 days later, the governor shut down the state. The state made a number of terrible mistakes. The one that led to mammoth number of deaths was taking those who were infected and had been hospitalized from nursing homes and bringing them back into nursing home environments. And it led to hundreds of deaths. There's, the governor once in a press conference said that was her worst mistake of it, but it hasn't gone much further. The state started to have some success over the beginning of the summer. June, cases were down in the first week of July 2nd, 3rd, 4th, down to around 20, 30 new cases per day. And there was some decent level of testing. So it wasn't just a function of we weren't testing, we were testing and the cases really gotten beaten down. Dr. Fine and I can talk about what we think led to that, but it was all positive. And we got very cocky. I think there was a sense that Rhode Island played nationally. The governor was on CNN and Morning Joe and all the things, talking about all the things the state did right. The virus doesn't care what you did right. The virus takes advantage of every possible opportunity to infect people. And we started to loosen things up. We started opening up bars and restaurants. We started to become somewhat, I want to say, cavalier. And there was a sense that Rhode Island was the best. I mean, literally, the governor's office placed some article. There was an article in Politico, the little state that beat the virus. By the beginning of September, Dr. Fine and I talk about the numbers on a daily basis, started to see the cases really begin to ramp up. And I'll tell you a little concerning number. One of the places, which was an early indicator, were the colleges. PC had an outbreak. And if you haven't seen it, PC's restricting things. They're having another little outbreak. And what happens is the kids come back from places far, far away, and they're carrying the virus. And it begins to spread, and it spreads not only within the college environment, but the faculty and the staff and the groundskeeper and all the other folks. And then in the case of PC, in the residential environments in that neighborhood. And we started to see the rocket take off. The governor's office, and I'll say it straight out, there was nothing malicious about it. They just didn't see it coming. I was on the phone every other day with pretty much David Ortiz, who's her chief of staff, forewarning what we thought was coming. And they were very, very confident. I think they got bad data from health. That's my take. Dr. Fine may have a different. And a wrong interpretation of what the trends were. So I don't know if you remember, the governor kept Halloween in place. The numbers were going through the roof. I mean, think about it. The numbers are going through the roof, and you're saying go door to door in groups and knock on strangers' door and have them hand you something. It just made no sense. Vaccine, so the first, Moderna announced phase 1 right around March 15th, March 16th, and we wrote about it then. And they outlined exactly what the vaccine and how it would perform. A week or 10 days later in March, Pfizer issued the same documentation of where that process would go forward. As we saw the fall developing, go 6 months later, we're not getting a firm understanding of how the state's going to deal with vaccinations. And you now had both Moderna and Pfizer in phase 3 and looking like they were going to come out with some approval and then apply to the FDA for what's called emergency use authorization, which means you don't have to go through the entire formal process. They do sort of a abbreviated process off the data of the phase 3 trial, and they give approval for its usage in order to expedite it to get it in people's arms. We reached out to the Department of Health and said, what's your plan? And they delayed giving us their plan for weeks and weeks. And then we really demanded it. And around the middle of December, when the state was getting hit the hardest, we broke the story that Rhode Island had the most infection per capita in the world, right? In the world. Think about that. It's like Providence schools being the worst in the country. You have to let it sort of, I'll skip over that. And by the end of December, we got the vaccination plan that had been submitted to CDC in mid-October. And there were mammoth problems. Any layperson could have picked them apart. The most egregious one was that their priority for vaccinations was school children. Well, the only problem with vaccinating school children is there's no vaccine in the pipeline at that point, at any point during the year to vaccinate children. Nothing, 0.0. And if you'd paid any attention to Moderna or Pfizer or Johnson & Johnson or AstraZeneca, none of those have been clinically tested for use with children. They are now beginning to, Moderna is now. And so why would you put it in your plan to the CDC to have a priority to vaccinate children if there's no vaccine for children? So they did not appreciate that we unveiled that. And that sort of sprung into a series of stories that we've unveiled. And then we started to not believe their data coming out of the Department of Health. And CDC was publishing data both under President Trump's administration, but then also it's functionally the same data under President Biden as well. So every day we list the data coming from the CDC as to how well Rhode Island has done in using its existing doses in vaccinating people. And it started at only 40%. It's improved slightly, got up to 62%. It's dropping down again. Rhode Island has received over 200,000 doses, and 80,000 of them are sitting on shelves somewhere. And so not a very effective program. We asked for all communications between the two agencies, the Rhode Island Department of Health and the CDC, and they delayed that. So we filed an APRA, an Access to Public Records request for December 1st to January 15th, because they said they were going to do a new plan and they couldn't produce it. So we asked for all emails between the two agencies. They blocked that. Then they gave us a bill for $3,200. So we wrote them a check for $3,200. I mean, think of the absurdity of this. We're asking for basic public documents from two government publicly funded agencies. They gave us a bill for $3,200. We paid the bill for $3,200 immediately. And then we enlisted the ACLU to sue them. So that's another time suck out of my life of dealing with lawyers suing a governmental agency to get the most basic information about the vaccination program. So discussions between our attorneys and theirs, we'll see if we get the documents early next week. If we don't get we'll be in court, and that will take forever and ever. It's not that I don't understand government. I worked for 2 senators. I was an appointee of 3 governors. I was on the Providence City Council. I have a good, firm understanding of the strengths and weaknesses of government. This has not been, from the beginning, a well-run project. And I'll end it with Joan's comment before we came on, which is, this isn't, the vaccination program is not a public health issue per se. It's a logistics issue. It's line people up in whatever prioritization you want to put. 75-year-olds, left-handed Albanians, it does not matter. Line them up, jab them in the arm, have them back in 21 days. That's it. You can try and make it more complicated than that, but it's all to the detriment of the exercise. And some states have figured out much better strategies, and they are vaccinating at much higher levels. And let me give you the states that are vaccinating at the highest levels. Alaska. Okay. I mean, we're losing to Alaska. We're not even losing to Alaska. We're like 46th this week, and Alaska's #1. I would say vaccinating people in Alaska, that would seem to be a complex matter. West Virginia. I won't even start on my West Virginia jokes. Okay. West Virginia is beating Rhode Island. The one time Rhode Island has the strategic advantage of being small, everybody lives within 50 miles of each other. We all know each other, right? We all have each other's cell phone numbers, and we can't get a functional vaccination program done. So with that, I'm happy to answer any questions.
Okay, please put your questions in the chat and we'll relay them. Let me just start with one. Either of you, what could we do now to speed this up? It's going at a glacial pace. the
So
vaccination.
let me jump in with that. And Josh and I don't always agree on this.
Okay,
But the first thing we have to do is commit more resources to do it. We are trying to do everything effectively by computer, and the computer programs don't work well, and everybody's getting frustrated. So that's one major roadblock. I think we need to stand up our municipal clinics and get them stood up right away, and get enough vaccine to them to be able to vaccinate first the 75-year-olds and then the 65-year-olds. I think we need and have needed from the beginning, a registration program where everybody who thinks they might want a vaccine could, enter their information and expect to get called back when it's their turn. We don't know who everyone is. We don't have a healthcare system in the United States, and that provides a fair amount of challenge just right there. So there are a bunch of things we could do, but I think we have to commit ourselves to getting them done. There are some limits placed on us by the amount of vaccine that's available. It's been about 16,000 doses a week. Supposedly it's going to go up, but I'm not convinced we're ready to handle a bigger number of vaccines should it arrive.
Yeah, I'll add two things. I mean, this is basic marketing. Tee up a website that functions, that actually allows people to register so they can be notified. That's easy. Secondly, create a call center with competent people who are trained to be able to answer basic questions. Hire 100 people, make it a 24-hour call service. We're talking about pennies on the dollars compared to what we've spent on this entire endeavor. Rhode Island has spent billions of dollars. A cost for a call center and a computer system is hundreds of thousands, maybe millions of dollars. And it would achieve a couple things. One, resolve stress. The amount of stress on this process is far outweighs many of the other aspects. And 90% of those who have died are 60 years and older. We can have a discussion about equity, but here's the equity. The equity is the people at the highest level of risk. By the way, they're the least going out too, right? So they're the ones who aren't going out and yet getting most exposed to a deadly virus because of other risk factors and age, et cetera. So those seem just common sense.
well, I have two comments that lead to a question. One viewer says her mother is 96 and on oxygen and has not been called for the vaccine slot, and she lives in South County. And the other says Warwick's 75+ program is limited to once a week because volunteers, doctors, nurses, pharmacists, checkers in can't volunteer more than once a week. So this leads to the big question a few people had. Why was this given? Well, first question, why was this given to cities and towns?
Well, let me tell you what I understand, and I may not be totally correct, but my understanding is cities and towns are being asked to register people, but the vaccines are being administered at, I believe, 5 different sites across the state. So the administration is not happening in cities and towns, only registration. I don't know why that decision was made. Cities and towns all have emergency management agencies, which have been training for this kind of thing for years. And so my sense of things is we would be better if we had clinics in every city and town, so that 96-year-old mother didn't have to travel to get the vaccine when it's her turn. Now, one thing about your 96-year-old mother is she shouldn't wait, because the way this is working isn't that people are going to call her. She's got to go call us, or call the state, or call somebody and go looking for a vaccine. We have also not included primary care doctors in the vaccination process, which was our traditional approach. So, it's not like most things where if you need something, you call your family doctor and they get it for you. Family doctors are not even, there's no plan, as far as I know, to have them vaccinate their own patients. And in my view, they would be the ideal person to vaccinate those 96-year-olds.
I think that's done in some states. They've given it to physician practices.
Yeah, no, it's part of the challenge, not just in Rhode Island, but nationally, is there's no national organization to approach this. This has all been given to the states to pretty much run their own, and every state is doing it differently. Every state is prioritizing who's going to get vaccine first differently. And that's the kind, in the context, we're not marketing, to Josh's point, we're not communicating. We don't have a single message that's clear so everybody knows what to do and how to do it. And that's a good bit of our challenge.
Okay, another question is, what about using volunteers? Why are programs using volunteers?
Well, I don't think there's a cohesive plan. Let me just state that, right? This is not, we may debate this. This is not that complicated. It's just not. There's 87,000 people who are over 75 years and older. They should have been started with first responders in December and January, and we would be now done with those over 75. Okay, they would be completely vaccinated the first time, and some would be on their second shot if that had been the strategy. There is no document right now, unless they're lying to us under APRA, and if they would, we would sue them again on that. There is no new document that outlines this. There is no button on the Department of Health's website to register by age.
Right, they say it's coming.
They say it's coming. This is not complex programming. There's nothing unique here. This is stuff that companies like us build things like this all the time. And people should be frustrated at the ineptitude. And there's one other X factor. The governor had a huge interest in joining the Biden administration and started that process around the middle of the summer. It became apparent. That was part of the PR strategy that she used, placing stories, appearing on national television. And she has been very focused on that, right? She's a very, very aggressive woman. She has a strategy in which she has pursued. She's never lost an election. She has moved up all the way through. And it has been especially painful now where she is no longer really governing. And Dan McKee is not allowed to govern because he's in this limbo position. He's not going to be the fastest starter in the world. I mean, if you know him, he's a lovely guy. He's an honest guy. He's been around a long time. There's some strengths to him that are different than the governor. But he is not going to hit the ground running at 100 miles an hour like some other types might. And so that's not going to speed this up a great deal either.
What do you, a question from a viewer, what do you think about CVS and pharmacy, the pharmacy options?
So I think
Is the solution?
It's certainly the White House has determined that it is going to be a major solution in their mind because they think the states are too slow. Dr. Fine has a different, we did have a piece picking up the Wall Street Journal article today that there's some issues related to what's called extra doses. So you open a vial, there's an extra dose. There's clear that there is manipulation of what is an extra dose and how people in healthcare have manipulated that. There's been well-reported examples of line jumping by prominent people, and lots of cases in which we've found out about efforts to line jump in very organized way. So, you know, there's cheating, no two ways about it. The priorities are not the priorities for everybody. And to be perfectly honest, probably everyone on this Zoom has enough connections that if they wanted to line jump, they probably could manipulate the process to be able to line jump. We're not those types of people. I mean, I'm not going to cut the line for somebody who's that 94-year-old who's on oxygen. That, you know, that person's at risk of dying. I'm at a much lower risk of dying. So, but that's the reality in which, and that's not unique to Rhode Island. That's going on across the country.
There's another problem with pharmacies. We'll see how they do. But in 2009, all pharmacies across the United States. That was the date at which all pharmacies across the United States became able to give vaccination for the first time. Prior to that, they did not do vaccination at all. And so over a course of a year or two, we added 60,000 vaccination sites across the United States. That was really aimed at influenza vaccination. What do you think happened to the influenza vaccination rate from 2009 forward? It either was flat or fell. Why is that? Nobody knows for sure. But my guess is it's because before that, primary care physicians had been the only responsible people to do flu vaccination, and they thought it was their ethical responsibility to call people in the fall and get them vaccinated. We went from a sort of a system to a real market. And in a market, which, you know, I mean, this is, pharmacies were vaccinating not because they had an ethical responsibility to care for their own patients, but because they had something to sell. And the market doesn't drive to public health in the way that, you know, ethical primary care physicians do. And I'm really worried that this thing is going to fall flat on its face. I mean, at this point, we need every available opportunity. We need to be doing mass vaccination sites at you know, at the Dunk or someplace else, and at McCoy. We need to be doing pharmacies. We need to be doing primary care physicians. We need to be doing city and town clinics, because it's a huge effort to vaccinate, you know, 750 or 800,000 people. And I'm using that number because I'm taking kids out of the mix at the moment, because there's no vaccine indicated for them. It is a huge, huge project. And we haven't really conceptualized it that way or scaled it up. We're trying to do this on the cheap, and it just isn't going to work very well, I don't think.
Well, it's not working well now. Another question, what about the storage requirements for the current vaccines? Is that?
They're complex. There's no two ways about it. I mean, it's rigorous. There's no room for error, especially on the Pfizer. Now, coming along is hopefully the Johnson & Johnson vaccine, which is now asked for an emergency use authorization. That could be approved in the next 10 days, requires an FDA approval and then a sort of a certification by the CDC. They supposedly have 100 million doses ready to go and could be out on trucks across the country. The president announced he's acquired another 200 million doses. I did not hear which vaccine it is. But right now, if Rhode Island got 200,000 doses of any of these, they would sit somewhere for days or weeks because there is no structure to be able to do this. And, you know, it's funny, there was a debate going on about one of the bonds that are coming up in March to borrow money. And it was about people questioning the one for the arts. Somebody said, oh, it was a leader in the African-American community saying too much money going to Trinity. So we're going to borrow money, right, for that, but we're going to try and run a vaccination program on the cheap. I mean, I don't know what more would be a better economic engine to the state than being first to vaccinate 80% of the population. That's the contest you want to win. That's the list you want to be at the head of.
And if you want to restart the tourist industry, you
Oh,
do that, and then everybody wants to come here because it's the only safe place in America.
I get another question. How have smaller states, Alaska, West Virginia, how have they done better?
No obstacles. Line them up. Put a needle in their arm. 100%. They don't play. This is not a civil rights battle. This is not an age battle. West Virginia, they literally call people off the street and say, "Come on over. Let's get you vaccinated." There's no sophistication to it. There's no checking the race box or or anything else. Their strategy is to vaccinate people as quickly as possible.
Which isn't ours. Another question, is there anything we as citizens can do to encourage our state government to move more quickly, more efficiently, to get their act together?
I would say it's a call to the Lieutenant Governor's office right now.
Oh, okay. Well,
It's McKee is the person to put the energy behind.
And I would add to that, I think it's worth calling your state senator and state rep. Just to let them know that this is an issue for people if it's an issue for people. Because I think we're kind of, through this whole thing, we've been sort of existing in this cloud of denial where it seems like, I don't think our political colleagues are getting the notion that people are bothered by it. It seems like people aren't bothered by anything other than the need to mask or the need to social distance, or the restricted. People seem to be complaining about the restrictions, but they're not complaining about 2,200 deaths. When people start complaining about 2,200 deaths, we will really have the ability to change the equation. But the only people that I think our legislators are hearing from are people who are running bars and restaurants and other small businesses, which are hurting. I don't mean to disagree with that, but that means that the bias has been protect business instead of saving lives.
another question, how do you feel about bumping teachers up as a priority?
Well, I'm greatly enthusiastic about that. Central Falls was has been the first city in the state to get vaccine. We're getting about 1,600 doses a week. And we just did it. We sort of lined it up in order. First, we did 75-year-olds, then we did 65-year-olds, and then we started on teachers. So I think the way you get schools back open is to get teachers vaccinated. And in my view, that ought to be a very high priority.
Do you agree, Josh?
Yeah, listen, you should be going where risk is. And there's two competing risks. One is clearly online learning for non-affluent students is a complete and utter failure. It is a lost year in academic development and social development, and will feel the impact of it for years. No two ways about it. We had Aaron Wren on, who's a genius urbanist, I want to say in April, and he said, those graduating from college into the Great Recession have not and will never economically recover. Okay? So think about that. Multiply the impact of that versus this. I'm an 8th grader and I lost last year. I'm losing this year, right? And for most of us on the call, I'm going to make the assumption we have a place in our house which we can go and put earbuds on and we have great internet, and we can go online, and we can do whatever we need to do. And it's safe and it's quiet. For most kids in Rhode Island, and especially in the urban corridor, none of those factors exist. 0.0. So certainly vaccinate all teachers over 50 years of age. Deal with the other teachers as that age cohort comes forward, because they're at minimal risk.
Okay, that sounds reasonable. Another viewer commented, do you agree that equity is getting in the way of efficiency? Do you see them as competing values?
I'll let Dr. Fine go, and then I'll go.
Well, I think the interest in equity is important and valuable. Certainly some communities were hit very hard and have struggled with this disease in a way that's unequal. But I also think that that there is an interest in efficiency and in getting every dose into arms as quickly as possible, if for no other reason than to forestall the development and spread of new variants, which pose a substantial risk. And I think the attempt to do equity only has slowed down the rest of the process. And I think we've heard the Department of Health say that that was the cost, as it were, of putting equity first.
I'll answer it slightly differently. Absolutely, it should be a component to, and there should be good energy put to it. It should not be exclusive. Listen, when we roll out grants or loans to small businesses, there needs to be an extra effort to include Black-owned and Latino-owned businesses, but not exclusively. We're not going to only loan to those two in order to restart the economy. I think, we spent a lot of time. We've been at this for 10 years. We spent a lot of time on the issue of equity. We've written big investigative stories. We've written 26 pieces about this contamination being dumped over in Olneyville. That's now under federal and state investigation. That story we'll be writing about for a year. It's a very significant story. It has huge legs to it. But right now, we're in a public health crisis. We need to get people vaccinated, and certain people are at tremendous risk, and that should be the #1 priority.
Well, in addition to lobbying and writing our lieutenant governor to be governor, what about writing and lobbying the head of the health department? Michael, did you receive letters from constituents who said, please do this, please don't do that?
Occasionally, but usually it was from people who were opposed to vaccines or who had chronic Lyme.
Listen, I worked in state government. Here's what directors respond to. The governor's chief of staff or the governor calls up at 9 o'clock at night and says, get this done.
Right.
And if you can't get it done, I'll get somebody else to get it done.
Okay.
That's what department directors respond to.
So they're not generals.
I'm sorry?
They're not generals.
No, but they do, but I think directors respond to governors, chiefs of staff, and governors themselves. Governors themselves, they really respond to.
Another question, do you think that there's a significant movement of anti-vaccination fervor in the state, as there is in California?
I don't. It turns out that Rhode Island, for every other vaccine, is the best vaccinated state in the country.
Really?
Yep, and has been so for 20 years, in part because of something called the Rhode Island Universal Vaccine Purchase Program. Something that's almost unknown is that we've been buying vaccine for every Rhode Islander for about 25 years and distribute it to all vaccinators. And so the market manipulation around vaccines doesn't exist in Rhode Island because of that incredible effort. And we've worked well with our primary care community, who have traditionally been, done much of our vaccination. There's a private company that does, called the Wellness Company, that does a bunch of vaccination as well. But that combination has been remarkably effective. And why it's not working now is, I think, open to question. And is it's very hard for me to see us not be the leader in vaccination for COVID-19.
Oh. Another question, why aren't the names of the line jumpers known? Like publishing in the newspaper.
Listen,
Why? Correct.
if we had them, we'd publish them 8 times over. We've tried. The hospitals refuse to disclose them, and the hospitals have defended it, claiming that they are part of their healthcare system, despite the fact that both health organizations, Lifespan and Care New England, have their board meetings on Zoom. So I'm not sure what the critical role of former Lieutenant Governor Roger Bijan, who's a financial advisor, is to the healthcare system, but he's not at tremendous risk for his future health based on his role as a board member. And I like him and he's my friend, but it is as perverse and embarrassing situation that leaders of our hospital systems would manipulate and undermine the credibility of the system.
And for me, it's been a huge disappointment that board members went ahead and took the vaccine when they did, and then when it came to the light of day, neither apologized nor resigned.
It shows the fervor of people to get vaccinated.
Well, it shows the fervor, but it also shows something about our culture, which is we no longer consider sort of acting in the public interest as a critical criteria on which we judge people's participation and involvement.
Listen, I think it's a question of character. It's chilling to think that we would fight World War II right now with some of the behavior we have, right? It would be a line of people jumping out of queue versus the people who are 17 years old lying on and their age to join the Army or the Marines or leave college or law school, the John Chafees and the Bruce Sunlands. John Chafee and Bruce Sunland would not cut a line. It just wouldn't happen.
No.
And if we were trying to land at Normandy, today, I'd be afraid that everybody would be swimming the other way.
You're right. Another question, I have here quite a few comments from people of horror stories, not just 96 and on oxygen, somebody who tried to get vaccinated, she lost the scrap of paper where she wrote the critical information down. She doesn't know whether she's on a list. The computer's jammed. Have you thought, this is Josh, of vaccination horror tale of the week, like bad bill of the week?
Yeah, I mean,
highlighting.
So the list would be too long. We get hit. We've never been hit by questions and comments and concerns about any issue in 10 years like this. It's dozens and dozens. And in many cases, the Department of Health is incapable of answering the question. I mean, we have the pipeline, even with a stressed relationship right now, we have everybody's phone numbers and everybody responds to questions. Most of the time, they simply don't have an answer to many of the questions. And it's a systematic failure. I mean, there's no other way to put it. Listen, we've all been in business. We've all run organizations. We've all run families, whatever it is. This is, I forgot to make dinner for the 27th time. I mean, it's just nothing works right now with any level of confidence. And there is no plan right now to fix this in a credible way. Hopefully that will develop. There've been small improvements, I think, because of the pressure to some degree that we put on them and the frustration of Rhode Islanders voicing those. But, we're in the middle of February. We've been vaccinating for 2 months. We knew we were going to vaccinate for 6 months easily before that. There's no excuse for any of this. Supply, you can't control. Systems, organization, competency, technology, all those things should have been done.
Do you think anybody in government is as upset as we, the viewers, are.
I think there's a growing embarrassment by some. Dr. Fine can disagree with this. I don't think it's permeated the Department of Health.
Yeah, I actually think there are a bunch of people at the Department of Health who are deeply committed, really hardworking public servants, who will work to 10 o'clock every night. And I think what we've seen in Rhode Island and around the country is the governor's offices have walked in and taken control of the public health process and distorted it for a variety of different reasons. You see Andrew Cuomo saying things like, experts, I don't believe the experts. His own, some of his experts are friends of mine. His own director, his own Department of Health director is routinely ignored. And it's almost like the sort of political class has lost its humility and decided that they could do public health and are doing it incredibly badly. That's where I think part of the problem is. And again, we haven't resourced it well, we haven't directed it well, and the end product is we are the most infected state, have been the most infected state in the most infected country in the United States, and somehow we have this idea that we did okay. We didn't do okay. I mean, if you compare us to a number of other countries, I haven't looked at the South Korea numbers lately, but a couple of weeks ago, South Korea, a nation of 58 million people, had something like 585 deaths. Rhode Island, 1 million people, we've had over 2,000 deaths. This is a cold virus. We could have and should have been able to stop this. And we have totally failed and haven't owned that failure one whit.
Another question popped up. Would federal money to pay states and cities, towns to hire doctors to vaccinate people to help?
Well, I think we need more resources for sure. And it's not just doctors. We're getting people vaccinated in Central Falls. Most of the people we're using are, people who are just high school graduates who were out of work, who we hired to sort of do outreach and communications and connections. You need those kinds of people to do logistics. Early on, I compared the number of people who helped stop the spread of the virus in Wuhan in China. They had, it's a nation of 11 million people, first place infected in the world. They stopped transmission, totally stopped transmission, but they brought in 42,000 healthcare workers. Adjusted for Rhode Island, that would say bring in 4,000 to 5,000 healthcare workers. At the height of the National Guard's activation, I don't think we got to 1,000. We need more people to do this. It can't happen just online. You have to knock on doors. You have to have people to explain things. You have to have people to translate things. You have to be able to, move people around. When it comes time to stopping the vaccine, you have to be able to enforce isolation and enforce quarantine. We did no enforcement of those. And you have to have when the disease is small enough, you have to have contact tracing that works. Our contact tracing totally failed, not just here, but around the country, in part because we let the disease get out of control, and in part because we refused to enforce isolation and quarantine, which are critical public health tools. We've lost our public consensus around public health, and that loss of consensus has led to this disaster.
One more question. We all have Medicare, or some of us, and Medicare has our birthdays. Also, Lifespan, Coastal Medical, and Brown Medicine have our birthdays, and patient portals to get in touch with us. Why can't these connections be made?
That is my favorite question of the night, though all of them were good. If we had a healthcare system in the United States, Our friends at CMS at Medicare would have printed out a list town by town of everybody who's 65 and older and given it to somebody who's doing vaccinating. And all those people would be called in order and get vaccines. That's what a healthcare system looks like. In the United States, we've accepted that we're going to turn healthcare over to the market. And so we don't have a healthcare system. We have an industry. Some people call it a wealth extraction system, but we don't have an organized system of care, and this is what results. And what troubles me is, despite this massive failure, I don't hear any outcry, any public outcry, saying not only fix this, but then go back and fix the healthcare system. And by the way, make sure that we get decent housing and that we have enough people with a decent income, so people don't have to live in poverty, which sets us up for this kind of mess. But
Joan,
that cry has disappeared.
Joan, one question I saw pop up was on the issue of the variants, the new strains, UK, Brazilian, and South African. This is a major concern, and I think potentially our failure to vaccinate as quickly as possible exposes us to more. And I mentioned that we tie in pretty much every week with Rebecca Couto da Silva in Bolzano, and that area of Italy has been not very hard hit historically. They've been one of the more protected regions of the country. They are devastated right now because of the UK strain, and they're in complete lockdown. And I mean March style lockdown because of the spread, the infectious nature of it, and what may or may not be, there's not science to it, a more deadly version of the coronavirus. The state again today announced lessening of a number of restrictions. They did it again a week ago. It's a mistake, and they cannot stand up to the pressure of these restaurant owners and bar owners. I get their frustration. I talk to them all the time. I talked to 2 different restaurant owners today. It's heartbreaking. They're on the brink of bankruptcy. But if we want this thing to end, we've got to get control of it. And there is no firm science that says Pfizer, Moderna, or Johnson & Johnson are going to be as effective against the variants as it is against the standard COVID-19. So, the thought that, we'll be done with it in 2021 just simply may not be true. And you may have seen the quote from the head of Johnson & Johnson saying, we're going to be taking yearly boosters for the foreseeable future.
Well, that's what we do with the normal flu. They recalibrate it every year. So I think we can live with that. But are there any more questions for people to type in? Then maybe we will let Michael and Josh, we will thank them and say that we hope they come back in a year and we can have this in somebody's house with tea and cookies. This will be on the league website. I think that it was wonderful to hear just a fuller perspective on the hysteria of the virus, the hysteria of vaccination, than we get from the Providence Journal. So I am grateful to both of you. And I hope that, I don't know, I want a Deus Ex Machina to come to save us all. But thank you. And good night, everybody.
Thanks so much. Greatly appreciate the opportunity.
Oh, we are grateful. Thank you.
Stay safe.
And wear an N95. That's what it's going to take.
Okay.